The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-host today, Otto Los and Paula Ewell. Paul and I work together at the town of North Hempstead Services for the Aging. And Otto, of course, is our volunteer friend, the face of Project Independence, all around inspirational guy, Otto.
I don't know about the face.
I mean, you are on the brochure, so I mean, we're going to go with
old photo.
You look exactly the same, I must say. If anyone has their PI brochure and you're watching our video, you could certainly see that Otto hasn't aged a day.
No.
But Otto, I'm glad because this morning we're going to have on a special guest. In a few minutes, we're going to have on Dr. Linda Lee, who is the Chief of Division of Gastroenterology at Northwell Health at North Shore University Hospital, Long Island Jewish Medical Center. And we're going to be talking all about the gut health connection, how your gut impacts your overall well-being. So we will be getting to that, which is certainly a hot topic. I see that all the time.
In the meantime, we're going to have to talk about something else.
Well, you know, I could talk about the gut health connection all the time, but it's something that I am very
You have
passionate
gut
about.
health problems.
I always have, yes. I have tummy issues. We're a long line of it's a family gene, you know. We all have the nervous tummies.
Gallbladder part of the, yes, it is.
There you go. I like that Otto's checking out the full body.
Well, I was told I have a gallstone.
Oh.
Stones, actually.
Interesting. What is there a thing for that, or
has never bothered me. I have no idea how long I've had them, but
really?
Probably be a question to ask. Now that I think.
Well, there you go. Mark, look, he's brainstorming while on air, Otto.
Yeah,
I like that. I like the list.
On my question list.
Well, Otto, while we wait for Dr. Lee to get in here, how have things been?
Well, to be honest about it, I had a rough run.
My friend.
You know, life is, we've talked many times on the show about losing people who are an important part of your life. And I lost a person who I've known since 1945 last week, my cousin, who his father and my father were brothers. And he was a very close part of my life. He was one of the people I walked with, you know, at Jones Beach. And we did many, many things over our life. But, you know, I'm happy that he was suffering. And, you know, it was at the point where everybody was praying that he would be at peace. So it's one of those things that we talk about frequently.
Not easy, though, my friend.
Well, it's one of the things we talk about is the need to look at those things as a celebration of life, that I had tremendous memories with this man, Billy, his name was. And that's what you have to look at. You can't dwell on it. If you hang around long enough, you're going to lose people like that. And, you know, I had the good fortune, which a lot of people don't, of having somebody that was in my life from 1945. Yeah. He was born, I was 8 or 9 years old at the time. So I look upon it as sad, yes, but also fortunate that I had that in my life. A lot of people don't have that.
Yeah.
So anyhow, you asked the question.
Look, though, and I think it's your outlook, and that's something that we talk about all the time on the show, how you really, you know, look at it that way, you know, and have the gratitude in an extremely sad circumstance, you know, but I think that is important to, you know, just look at how beautiful all the amount of years you did get to spend together, and something I think certainly many people could relate to.
Well, we did a lot of really, really dumb things too.
Well, see, but that's probably the best thing. Oh, good. We're going to get one. We're kicking off the morning, right?
We got into a thing in our life where we were doing kite flying for the kids, kind of thing, all right?
Okay.
So we would take the kite and bring it up, and then you'd have to pull it back down with your own string.
Mm-hmm.
And what we decided to do was we weren't going to do it like that. We were going to use the spit on a grill.
I mean, you're crafty. Anything inventive.
We tied all kinds of rope and strings together so that when we let it up, we wouldn't have to worry about winding it back.
There you go.
So we let the sucker go, and you could not see the kite. where it went.
Oh, well, that's what it's about.
And we got the
Wonderful
kite back
memories.
by putting the spin on, to go the other way.
Oh, I love it. Well,
But, we did a lot of brilliant things like that.
well, good. Those are the best kind of
Yeah.
memories. But Otto, we are going to take a short break, and when we return, we will be speaking with Dr. Linda Lee all about the gut health connection, how your gut impacts your overall well-being.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
so I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
and I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
and then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Paula Ewell and Otto Los. We're jumping in with Dr. Linda Lee, who is the Chief Division of Gastroenterology at Northwell Health, North Shore University Hospital, Long Island Jewish Medical Center, and we're talking about something near and dear to my heart, the gut health connection, how your gut impacts your overall well-being. Welcome to the show, Dr. Lee.
Thank you so much for having me today.
So I want everyone to know, we've talked about it before, you were at our advisory a couple of months back, our Project Independence advisory, and we recapped it on the show because you did such a really wonderful job. And this is something that, I think is such an important topic because people don't always realize how your gut impacts so many parts of your body. They think it's like this isolated thing that just hurts, all the time. But so let's dive in. So what is the gut? Like what is it? How does it impact your body?
Yeah. So as I said in my little talk there, that a lot of us don't even really give our gut second thought, right? Because we all just take it for granted that we
Right, it's
should
just
be
kind of
able
there.
yeah, we should be able to eat whenever we
Right.
want. We should be able to eat whatever
What-
we want, and that we should feel great. And in fact, there are people that we all know
Yeah.
who will say, "I have a cast iron stomach. I can eat whatever I want." But for a lot of people will experience GI symptoms, and immediately people are saying, like, "What is wrong with me? Is there something wrong?" And there could be something wrong. But also you may have symptoms when something's really not wrong. It really is a consequence of what you've eaten. And so the GI tract is very, very complicated. It's not just a tube that has an opening at one end and an opening at the other end.
Right.
Yeah, it's very complicated, and I don't think it gets the respect that it deserves.
Now, your background, are involved with practice still with patients?
Oh, yes. Oh, I'm a very active practitioner.
And then
I
you're
love
also
taking care of
an
patients.
associate professor,
Yes, I am.
and you also do research.
Well, I have, yes.
You have. So
Mhm.
you're kind of we're not going to get too many people who know more about the gut path than you.
Well, I don't know about that. There are a lot of brilliant people in the world, much more brilliant than I am for sure. But I do have a passion for talking about it and learning about it because there's still so much to learn.
Right. Well, I mean, when you look at the gut tract, like we're not on television, we are partially, but
Yes.
there are so many components to it that,
I know.
Yeah, let's talk. What is part of? Because as you're saying, it's not just a tube with two ends.
Yeah, so your GI tract starts, your mouth is kind of part of it, although we've given that over to oral surgeons and dentists, right? And ear, nose, and throat people. But we, as gastroenterologists, really focus on disorders or symptoms that arise in the esophagus, the stomach, the small intestine, the large intestine, also known as the colon. We also focus on liver, pancreas, gallbladder. So all those organs, which is why I say our field doesn't get the respect that it
Right.
deserves. This
not a lot left.
cardiology. There's only one organ.
Yeah.
Let's remember that.
That's
But
right.
We have a lot of organs, and all of it. It's like amazing. It's fascinating how they all work together, so that we can hopefully go through life enjoying what we eat and not having symptoms. But again, sometimes we do.
The complexity of the gut tract, if you will, the GI tract, is such that I wonder how difficult is it for somebody like you to diagnose when somebody comes into you
Right.
and says, I have a problem. Or frankly, maybe they don't even come in and tell you they have a problem.
Yeah.
the old story about when you go to the doctor, if you don't tell the doctor that there's something wrong, well, the doctor doesn't know. So let's start out with, I feel like I have a problem. All
Yeah.
right. What should I do before I come to see you, maybe, to be prepared to describe this problem and maybe help with the diagnosis?
Yeah, so when I first meet a patient in the office, anybody who's seen me before, they know I'm going to ask them 1,001 questions. And so I always like to understand what is the nature of your discomfort and how has it negatively impacted your life? Because I feel that sometimes we can focus in so much on a symptom, but the real question is, does it interfere with all the other interesting things you would rather be doing than thinking about this symptom, right? And that tells me how important and how disruptive that is. And sometimes people come with multiple symptoms. And I sometimes have to say, let's just focus today on our first visit on the thing that bothers you the most. And then we will tackle all the other different things.
Would it help like a blood pressure problem? They may tell you take your blood pressure every day for
Yeah.
X period and record it. And when you come into the doctor,
Yeah.
should you do something like that for, let's say, not a cocktail topic, but bowel movements?
Oh, yeah. We call that, we actually have a term for that. It's called the stool diary. So,
It's a cute little name. It's a cute little name, guys.
so anybody who
That sounds better than
so anybody who's experiencing issues with bowel movements, whether it's diarrhea, constipation, or pain with having movements, it sometimes is helpful to keep a little log as to, what happened on this day, because it might allow you to go back and figure out, like, what did I do different that day? Did I eat something different?
Right.
Does this happen to me every time I eat at my mother-in-law's house, or does this happen to me all the time, right? And those are the kinds of questions I do ask people. And sometimes when people come and they aren't really sure, I do ask them, okay, your homework is, before I see you again, I need you to keep a little diary, just get a paper journal. There are apps you can use now too.
Oh,
And then, and yes, and the next time you come to see me, then let's just like sit down and analyze it. And that's particularly helpful for me for patients who have symptoms that come and go.
Right.
Like they have intermittent diarrhea or intermittent constipation or intermittent pain. Like that to me is
So
very
there's
helpful.
a lot of things then that this is kind of like the end result maybe of a problem, like frequency. What did it look like?
No, those are all very important questions for me.
So,
Yep.
but as a patient who has the problem, it would be good if they did that before they went to see you.
It would be good. And if they haven't done it, though, as I said, they can do it prior to the next visit.
Right.
Yeah.
Okay.
Yeah.
Yeah, so with your gut, I mean, I know there's all these terms that we hear thrown around, microbes and prebiotic,
Oh, yeah.
postbiotic, like all
Yeah.
these things. So let's just start from the beginning. So what are microbes? I mean, it sounds like there's a lot going on in there.
Yeah. So microbes are bacteria, but other organisms too. We know it can include fungi and viruses and other organisms that are microscopic, hence the word microbes, right? So we now know that the GI tract is full of microbes, and they are a very important part of our health and well-being. We could not have developed a normal immune system if we didn't have microbes that colonized our large intestine primarily. We have a few microbes in the small intestine, but the body was designed in such a way to keep those microbes mostly in the large intestine. And it's there where we have kind of a symbiotic relationship with these microbes, because the microbes, they benefit from the things that we eat that we don't absorb, but we benefit from the things that they produce as part of fermenting or processing some of the nutrients that we eat and don't absorb. Our microbes will do that in our colons, in our large intestine.
Now, terminology wise, all right,
Yes.
there's another one, microbiome.
Microbiome.
Right.
Microbiome
What
refers.
separates that from the one you just talked?
So they're the same, but microbiome says biome means like there's a world. It's
It's
a
like their little
community.
house, right?
It's a community.
Village.
Yeah, so if you think of your colon as home to a community of organisms, and now what we really are interested in is understanding how this community of organisms not only contributes to health and well-being, but how this community may also contribute to disease. So we have found, not we, but many researchers in the world have found that there are connections between disturbances in the community. We know that there are healthier bacterial or microbial communities in the intestine, and there are less healthy ones. And so now the question is, of course, everybody wants to know, how can I make sure I keep a healthy microbiome as opposed to one that's going to contribute to disease and symptoms, right?
How do you test for that, though? I mean, is there a test for microbiome?
Yeah, so there's a lot of desire for tests, and in research, there are ways to analyze the microbiome using very high tech, biochemical and genetic and all kinds of assays. And you will find that there are companies out there that say that, hey, we'll analyze your stool for you. And if you pay us this money, and you're going to get this nice little printout, and that will tell you about the health of your community. The problem with that is, while that stuff is really interesting, it's kind of, what do you do with that information?
Right.
First of all, a lot of that information is not with enough detail to really, for a medical person to do anything about. And the second thing is that sometimes it can cause a lot of concern and worry that leads people to adapt to behaviors that are basically unhealthy. I have met patients who've brought me their stool analyses, and based on from these commercial companies, and based on that, they have significantly restricted their diets, and they sometimes have lost weight. And they find that going out to eat is no longer an enjoyable social experience because they are so restricted. So I really caution people about that. It's interesting if you are interested in that. And remember, these companies are also collecting your data. Likely, it's just like the DNA test that people did, 23andMe, and, while you get that information back, and while it's really interesting, it's great if you want to study lineage and all that. But when you're talking about disease, it gets really, really murky.
Well, we're going to pause right on that because we are going to take a quick break. After the break, we will continue talking with Dr. Linda Lee, who's the Chief Division of Gastroenterology at Northwell Health, all about the gut health connection, how your gut impacts your overall well-being. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with our co-host today, Paula Ewell and Otto Loos. We're diving right back in with Dr. Linda Lee, all about the gut health connection, how your gut impacts your overall well-being. And before the break, we were talking about the microbes that are in there. And I was just wondering, with microbes, is that something that you were born with? How does that, is it something that grows with you, or how does that all work?
Question. So it turns out that's really important, because when you're initially born, you have a sterile gut, meaning there aren't any microbes inside your intestines. But as soon as you're born, you begin to get colonized by your mother's microbes. And what microbes that she has colonizes you is partially determined by the mode in which you were delivered. So we know there are differences between individuals who are born by cesarean section versus those who are born by vaginal delivery. It's not to say one set of microbes is better or worse than the other. It's just that there's a difference. And then you continue to evolve, whether you're breastfed, you're bottle fed. It turns out that diet is a huge shaper of your gut community. So whether or not you grew up in a place where you ate a lot of plants, and fruits, or you were primarily carnivorous and ate a lot of meat, that really kind of shapes the way your gut microbiome evolves. Further factors that will shape it too will be whether or not you take medications. So antibiotics has a huge impact on what happens with our gut microbiome, not just as children, but even, as we know, in adults. So I'm very quick to say that, if individuals want to maintain a healthy gut, I really advise staying away from antibiotics if you can,
there are many situations historically where we healthcare providers recommended antibiotics as prophylaxis. Like you go to the dentist and they say, oh, I pulled a tooth, so you need to take this antibiotic. Well, a lot of that has come to question now because we now know that taking an antibiotic when you don't have an active infection, right, may leave a lasting impact on the gut microbiome. And we've seen an emergence of antibiotic associated diarrhea. And the worst possible one is C. difficile colitis, which results from that. So there are times when people absolutely need to be on antibiotics.
But
I'm
that's
not, yeah.
an interesting area, right? Because
Yes.
my dentist years
Yeah.
ago said, go on this antibiotic.
Often, I mean,
I'm still on that antibiotic.
Uh-huh. Well, but again, you need to understand like what your medical condition is or dental condition, and maybe there is a reason for that. But all I'm saying is
Yeah,
that
I
we are a
understand.
little more hesitant to just put everybody on antibiotics, even though we believe antibiotics to be a good thing, but they do have their consequences.
You know, like as a layperson, you hear the word gut community,
Yeah.
immune system. These are like mysterious clouds somewhere.
Yeah.
Like you visualize a bunch of little micro,
Yeah,
whatever,
like
bacteria
little hard
walking
hats, you
around
know?
in your community.
Yeah.
They're very busy. Yeah.
And the immune system's another, it's all connected. I mean,
That's right.
there's like big mystery.
Well, let me just state right here, because the gut, that's why I'm so fascinated by the gut, because there's a lot of things that intersect in the wall of your gut. So you have a set of nerves that are there called the enteric nervous system. And these nerves are what drive your whole digestive process. They're so remarkable because these nerves can sense, for example, the composition of your meal, how much fat, protein, and carbohydrate is in it, and regulate how quickly things are going to pass through your gut, for example. The other thing that these nerves do is that they trigger the contraction of the muscle that is in the wall of your entire gut, from esophagus all the way down to colon. So that's how things actually move through your gut, because if you didn't have the nerves or if you didn't have the muscles, everything would come to a standstill. You could not eat. You couldn't poop. Nothing would happen. It's not gravity that does it. So these nerves deserve a lot of respect because they also communicate to the brain. So, and this is why there is this gut-brain connection where many of us, if you have felt anxious, or I always say if you felt in love and you felt those butterflies in your stomach, that's your brain talking to your gut nervous system, the enteric nervous system. But going one step beyond that, the nervous system, which is embedded in the wall, is sandwiched also with 70% of the immune cells in your body.
Oh, wow.
Well, there was a thing in New York years ago, the bodies, I think it was called.
Oh, yeah.
And it talked about 1,000,000 miles of nerves in your body.
Yeah, it's incredible.
Yeah.
Yeah, our bodies are really amazing.
Unbelievable.
Amazing.
Yeah.
Right.
But you know, it's, and I remember, learning about this when you were at the advisory, and it really stuck with me, that, like the combination between your brain, because we all say, like, listen to your gut, and that's like a saying we've literally said forever.
Yeah.
And then it makes sense, because I remember after your presentation, when I told my husband, I said, it all makes sense now. You say, listen to your gut. There's all these nerves in here.
And that's true. I think in our culture, in our society, we have this desire to not listen to our gut. We question, how come I feel gassy and bloated, or I feel uncomfortable if I eat certain foods? There must be something wrong with me. I should be able to eat whatever I want. And that may not be really true.
Yeah, I mean, we're all different. We all
all
come with a different package when we start.
Yeah.
I know. And since it came from my mom, I'm going to have to have a talk with my mom when I get home saying, blame her for my my microbe situation.
Yeah, you want to get a little more detail
It's going to be like the nerve.
on how your gut community started out.
So, obviously we were, off the break, we were talking about, kind of just ways to, be proactive or ways to respond to certain things. So I'd love to kind of, how to, maximize your gut health.
Okay. So to maximize your gut health, the number one thing I recommend to all my patients, which is completely evidence-based, is to eat a high fiber diet. And when I say a high fiber diet, I'm talking about 25 to 30 grams of fiber every day. Now, most Americans eat about 15 grams of fiber every day. So you can see that we're behind. And just ensuring that you eat a high fiber diet, we know that fiber is food for your good microbes in your gut. Those microbes love fiber. They make good things that our body benefits from as a result of fermenting that fiber. So any kind of fiber, if you don't feel that you can routinely eat a high fiber diet, then there is nothing wrong with taking a fiber supplement every day. And I generally recommend that if you're going to do a fiber supplement, it could be any of the fiber supplements that you prefer, but that you get at least 5 grams a day.
5 grams.
So eating a high fiber diet, eating a diet that's rich in vegetables and fruits, and minimizing the ingestion of red meat, because we know that a diet high in red meat is a risk factor for colon cancer. So when people say, well, exactly how much meat are we talking about? And I would say, and this may be extreme for some people, that if you limit your red meat intake to the size of a deck of cards once a week, that would be ideal. That's really hard,
Yeah.
you know, and I understand that, but you know, this would be my recommendation. We talked about avoiding antibiotics if you don't absolutely need them.
Right. If you're taking antibiotics, what's a good food to be taking with them?
Yeah, right.
Would you suggest?
So some people take a probiotic, and that's so we should probably talk about that, because I get asked about that all the time.
Right. Because I mean, that's just like the buzzword, right? Like, so you'll see it like all over
Right.
the
And you know, conceptually, it's great. Like, I understand the desire to maintain a healthy gut microbiome. And we do know that for certain medical conditions, taking a certain strain of bacteria, which is what a probiotic is, can be beneficial for people who have that disorder. What's happened, however, is that people have read about this and assume that all probiotics are great for everything. So I get asked about, well, shouldn't I be taking a probiotic for general health or general gut health? And the problem is that we don't have evidence to support that some of these probiotics are very expensive.
Yeah.
The good news is that most of them are safe. And the problem is that we don't know what strain is right for each individual person, because it turns out there's not just one definition of a healthy gut microbiome. There are probably multiple ways, you know, different constituents of a bacterial community. Like what's healthy for you is different for me, is what I'm saying. So what probiotic strain is beneficial to your gut community could be different than mine. And that's what we're having trouble with. So we're just not there yet. And even people who want to do stool analysis and like use that to determine, because that's what a lot of the companies out there want to do, is they're going to analyze your stool, but then they're going to want to sell you a probiotic.
Right.
So my suggestion to people, after I explain all this, is that if you want to take a probiotic, then by all means, you know, think about doing it. I recommend that you just do it for 30 days and determine at the end of 30 days, did it help you achieve whatever goal it is that you were trying to achieve, whether it was regulating your bowels or reducing bloating or making you feel more energetic or whatever. And if you don't feel that it has honestly achieved any of those things, then stop it and either switch to a different probiotic or do something different. If you feel it's been beneficial, you probably have to stay on it, because what we know about probiotic strains is that if you stop taking the probiotic, it rapidly disappears from your stool. So, you know, it's not like you can take it for a while and you've completely, repopulated your colon and now you can stop it. No, you are probably going to end up having to take it if you want to maintain whatever benefit it is that you think it's giving you.
Well, you know, we used to go to Dr. Google. Now I went to AI.
I'm sure it's not
And AI, I said, what is the fiber supplement, the best fiber supplements? All right. And what they said was Metamucil, Benefiber, Citracel, whatever. There's a list. In other words.
Yeah. And I
The
think
old reliables, right?
I think those are all very reliable. And I always, the one that is the most popular formulation for all my patients, regardless of whatever age they are fiber gummies.
Fiber,
Everyone loves the gummy.
Gummies, everybody, you know, I always say, I just gave you permission to eat 2 or 3 pieces of candy every day.
Yeah, there you
Now,
go.
dentists will hate me. Dentists do not like people who their teeth, you know, who have teeth where they've been eating a lot of gummies.
How about things, I remember my mother, frankly, it goes way back, prunes.
Yeah, so prunes are very interesting because they do have fiber, but they also contain a carbohydrate that gets fermented in the colon, and that makes us go a little bit,
Right.
you know? So if you eat a lot of prunes, you might get a little gassy, but it also may help soften up your stool a little and help you go. So I'm a big prune fan. If people like prunes, I don't think you should force yourself to drink prune juice or eat prunes if you really detest them,
Right.
because there are other ways to help you go to the bathroom. But if you like prunes and it's working for you, then great.
Well,
Thing is like too much fiber. Like, are you just like, like, because I've heard like people like, oh, I definitely had too much fiber. Like, is that just their
I
imagination?
don't think that there's any harm in having, quote, too much fiber. There have been studies done that there are some communities in Africa, I believe it was in Kenya, where there are some people who have consumed 60 to 70 grams of fiber every day, like since they were born. Like, and so for us, remember I said we're pretty low fiber. Western diets are pretty low fiber. If I were to suddenly go from my usual, let's say 30 to 60, I'm going to initially probably feel very gassy, and I might have some looseness of stool until my community adapts to having all that fiber around. So it will be kind of a little shocker, I think. And what's so interesting is that some of these, vitamin companies, like, so I go into some vitamins shops just to see what my patients are looking at. And I see these things called colon cleansers.
Yeah, I mean, they're the market.
And I love to see like what the ingredients are. Well, let me tell you, I mean, I was amazed. This one, like if you took it the way they told you to take it, it was 60 grams of fiber. Yeah. And then they throw in some other, they throw in some other laxatives too. So
Wow.
that's what colon cleansers are. They're just high priced laxatives.
Right.
well, like last week, I had pasta visual soup, which has a lot of beans in it.
Oh, beans.
Beans are good.
Yeah.
Love beans.
Public record the next day. I had no problem.
So beans are high in fiber, but they also contain a carbohydrate called raffinose, which is a carbohydrate that we human beings actually don't normally digest.
Okay.
So humans lack the enzyme to break down the raffinose, which in other species, I guess, if they have the enzyme, it will break it down so they can absorb it. So as a result, the raffinose that we eat will pass all the way through the small intestine, not getting absorbed, because the small intestine is where we absorb our nutrients. It'll end up in the colon, where our bacterial communities are very happy to ferment it for us.
Right.
I could just see them now standing there. Wow.
That's why beans, gas, right? We all have some degree of gassiness when we eat beans, but whether or not we're uncomfortable from that really depends on the social situation, the sensitivity of the nerve in the gut. So we know that 12% of the population have really sensitive nerves, this enteric nervous system I was talking about. And so let's say you and I eat the same bowl of beans and we both get gassy, because I just said everybody's going to get gassy, right? But let's say I have pain from that same amount of gas and you don't have any pain. It's not that I made any more gas. It's just that my nerves are really sensitive to the distension of the intestinal wall in response to that gas. And now I have pain. That's what we call visceral hypersensitivity or irritable bowel syndrome, because that distension will trigger discomfort and may even, I don't just have gas and pain, I may actually go have diarrhea.
Right. So it's like a trial and error proposition as far as every individual goes.
Correct. But there are some tricks. So, and I offered them during the talk, like if you like beans, because beans are really great for us. I mean, I'm a big bean fan. They're
like
so healthy.
Rice and beans is a good deal.
Yeah. It's a staple all over the world, and there's a reason for that. But if you don't want to be so gassy with beans, there are some ways to prepare them. And that is, if you use canned beans, you rinse them. Don't get that gooey liquid stuff, because the raffinose leaches out into it. So if you dump the whole can with the gooey stuff in, that's like you just gave yourself a batch of raffinose.
Well, we're going to take a quick
just-
break, though. After the break, we will continue talking with Dr. Linda Lee all about the gut health connection, how your gut impacts your overall well-being. You're listening to Project Independence and You on LIU Public Radio.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts today, Paula Yule and Otto Lowe's. And we're doing all things gut health with Dr. Linda Lee. We're asking a lot of our own personal questions, I think, to get our microbes equalized in here. Because I mean, as we're talking about, it's like you just picture like little things, like little hard hats, like the Doozers and Fraggle Rock or something. But that's what I think is going on inside my gut. They're really working overtime. But prior to the break, we were talking about, probiotics and all these different things. And, I've always tried to err on the side of like finding the food, right? Instead of having to take a pill or supplement, I'd rather like kind of incorporate that into the diet. So what are some like foods that probiotics like?
Yeah, so those are mostly like the fermented foods, and the first one that comes to my mind, of course, is like kimchi. It's so, and there's other what else? Sauerkraut.
Pickles?
It depends on how they're fermented. I mean, they're in the vinegar, but the idea is that
like pickles.
whatever you're fermenting, you're cultivating organisms there that are ultimately beneficial for your gut. So yeah, so but the issue is some people don't like kimchi, don't like sauerkraut, don't like I'm thinking about kombucha, and if you don't like those things, it's a problem to get them down.
I mean, a question I would ask is how much sauerkraut do you have to eat?
Nobody knows.
If you put a little bit on top of a hot dog,
does that count? Does that like outweigh? Does
Yeah,
that,
that-
Guess you just have a hot dog.
does it make it a good?
so the hot dog is a
Not
bad
good.
guy, and sauerkraut
No, it just kids balance it
Yeah,
out. You're right.
yeah.
or onions.
Yeah. So
I happen to like garlic, and I did read that garlic is a good probiotic.
Yeah, and the problem is that there are people though, when they eat onions and garlic, they get very gassy with it.
I
And-
can't. I have like definitely a garlic intolerance, and it's very unfortunate.
Intolerance.
Yeah.
See, me, I love
I love
Yeah.
good garlic.
Yeah.
And I get asked that question all the time. Like, these foods, you told me, or these foods are supposed to be good for me, but how come they make me feel bad?
Yeah.
I feel more bloated. I feel more gassy. And so that is just really a product of how sensitive your nerves are to that gas production. And it means sometimes either modulating the quantity that you eat in the course of 24 hours. So for example, if you know that you have a sensitivity to garlic, that's not the day you want to eat other foods that are ultimately going to be like, you won't need a bowl of beans.
It's
and
so true.
eat apples and eat,
Yeah.
'cause those kinds of things
Right.
sometimes cause a lot of gas. So it's all cumulative. But you can also take enzymes too that you can buy over the counter. You could take Beano. Beano is great for
Beano-like
legumes.
products.
And also Beano is good for like cruciferous vegetables like cabbage and broccoli. And then if you're lactose intolerant, because a lot of us like dairy, right? Then you could take lactate pills. So these pills, these capsules contain the enzymes that we don't have, but you need to take it with the food that you're eating. And the number of capsules you need to take have to kind of reflect the portion size and also kind of what your sensitivity is. So
Oh, and I think that it's such a good point that you bring up, is about this individual kind of nature of things because, so much of what you see on these commercials and marketing are these blanket things, that are wonderful for everyone. And I do know because as someone that always has
Not
some
if
kind of
you're
stomach
allergic to it.
issue. Yeah, but if you have some kind of stomach issue, like I do, and I think so glad you said that because the cumulative thing is such a factor. And that's why I think, keeping these diaries is probably good because, when I was saying about garlic, there's times that I'll be at some, and like, I know there's a little garlic in it, but it hasn't, right. And, because my husband likes to call me a vampire. And I was like, it's interesting, but then I realized, because it wasn't whatever else I was having that day, and I think that that's such an important thing to kind of track for yourself when you're doing this.
But isn't a little gas good?
that's so funny. You depends on who you ask.
He has a t-shirt.
Okay, for
I've
men,
been going with that for
in my
years.
experience, not to be, sexist there. The men don't care, but for women, we don't like gas. Like culturally for us, socially, it is not, we believe, unfortunately, but it's really a myth. like that we should not have
Yeah.
any gas. But our colons are just the same as male colons. In fact, our colons are
Well, I
like
mean,
a little longer.
nobody's really gas-free.
Exactly.
Yes.
So
Right.
if somebody says they never
They're
have gas,
lying.
That's
Yeah.
it.
or they're
Gasless.
completely oblivious. It gets too
Like you don't hear anybody saying, "Oh, she's gasless."
And I've been known to say to some of my patients that sometimes, like when you have gas, it is a sign that your your bacterial community is thriving in there. It is a sign.
You ought to
that
even
they're
go with that. Be like,
fermenting.
my
Right.
community's just thriving. You're jealous. My community's thriving over here.
Now, there are some bacterial species that produce a different kind of gas that can make us uncomfortable. These are the methane producers. So again, people now are paying a lot of attention to that. Well, what kind of gas am I predominantly making here? And are there ways to manipulate that? And so the only ways that we have to manipulate the gut microbiome right now are antibiotics, right? Diet,
Water.
and
How about
and
exercise?
fecal transplant.
Oh,
But we
Ooh,
don't want to
that's
talk about
rough.
that. Yeah.
transplant. That's
Yeah.
You said something earlier when we were going into the break about canned beans and
Yes.
rinsing them.
yeah.
Yes.
I never
rinsing
heard
them.
that.
I do
Yeah.
that all the
Me too.
time
It's
after
just-
your chat.
it's
I
gross.
bought
Has
a
it made a
little.
difference?
And I feel like I just feel like it
You
tastes
rinse the
better.
beans.
Yeah, I have like a
Always
little
rinse.
strainer,
Right.
like a cute little tiny one, and I put it in.
Now, how do the
I
beans taste after you?
just think it tastes
I
better.
always
Yeah.
rinse my beans.
Yeah, like,
I
it's just
think you were never
cleaner.
supposed to eat the gooey stuff. It just went.
Yeah.
Like
I've
baked
rinsed my
beans, you
beans
can just
forever.
Yep.
dump most of the stuff.
Well, I don't buy.
Well, I don't-
not
I don't
baked
think-
The
beans.
not the
Not like saucy. Like we're talking like
Just,
black beans,
no.
pinto beans, or
Yeah,
Or-
like white beans,
Oh,
bologna
without
beans,
anything, like no
Yeah, what they
sauce.
come in.
Yes,
It's
exactly.
like thick, like gelatinous almost.
Right.
You rinse all that off, and it's just a bean. It
Yeah.
tastes much.
Yeah.
Then you can taste the bean.
You're right.
I think.
And if you soak your beans, a trick too is to add a little baking soda to the soaking water. Because and I've seen that, I'm very
I like
interested
that.
in cooking, and I see that in some cultures they do that routinely because it softens the skin on the beans and makes them softer faster. But what it also does, it pulls the raffinose out. So again,
soda would you?
I I don't okay that I have not figured out. It's like a habit.
That I've not mastered.
Volume, but
Okay.
add baking soda, and then again after you've soaked the beans, you throw that water away. You rinse it.
Yeah.
You get rid of it.
You don't use it.
Yeah.
Yeah. I had a question about water.
Yeah.
Like how much, because you really think just logically drinking more water
Yeah.
would help you.
Yes.
Is there like a certain amount that you should shoot for?
Yeah,
Or,
it's
you know,
really
very
hard.
variable.
It's highly variable because, of course, it depends on the level of your physical activity. And I mostly, when patients ask me that, my question to them is, well, how many times are you urinating in a day? I can pretty much tell you that if you're only going 2 times a day, probably you're not drinking enough water.
Yeah.
And how intensely yellow is the color of your
Oh, that
urine?
does make a difference.
Right?
Yeah.
If it's dark yellow, you probably aren't drinking enough.
Mhm.
Now, people do get very fixated, people who have chronic constipation. So, and I just want to put this out there because I feel very strongly about it. But there is a belief that people who are chronically constipated, that somehow it means that they're not drinking enough water, they're not exercising
Right.
enough, and they're not eating the right foods.
True.
And I'm going to say right now that those 3 factors are more important for people with acute constipation, meaning that you travel someplace, your bowels aren't really the same as they were because you've had a change in, location
Right.
and diet and
Yeah.
time zone and all that. That's where water, diet, and exercise can really play a role. When we get into those individuals who have chronic constipation, which is defined as having constipation symptoms for 3 months or more, drinking a ton of water alone is unlikely to fix your problem.
Okay.
All right. I'm not saying you shouldn't still drink
no,
water,
right.
but I'm just saying that to believe that, I wouldn't have this chronic problem
Right, if you
because
drank more water.
if I
Right,
drink more
right.
water, because we now know that there are physiologic reasons to explain why some people are chronically constipated. And that's a whole separate
Well,
thing we could talk about some.
Yeah.
many years ago, I was told that I had a slight bend in my colon,
Uh-huh.
which caused things not to go through as quickly,
Uh-huh.
and that causes that kind of problem.
It was a chronic constipation.
Well, not chronic, no, occasional.
Oh, occasional. Okay. All right. Well, we do have a lot of bends in our colon. So,
Yeah.
possibly, I guess.
Yeah.
Yeah.
And with obviously with probiotics and stuff, you always think yogurt. I mean, that's where my brain goes,
Yeah.
right? It's like yogurt. So now, is that a myth? Is that a truth?
Yeah, there's a lot of debate
Yeah.
about whether yogurt is truly a probiotic. So to be defined as a probiotic is, number one, it's supposed to be beneficial to our health. And number two, it has to survive the digestive process, meaning that if you take a probiotic, I should be able to measure it in your stool, meaning that it made it all the way through. And the problem with yogurt is that the strains that are used to ferment the milk to create yogurt, they do not necessarily survive the digestive process. Okay. Now, that's not to say that yogurt isn't a fine food to take, high in calcium.
Right.
The other thing is if you're lactose intolerant, the lactose is usually digested by those live organisms. The problem is that they don't necessarily survive digestion. So we don't really classify them as a probiotic.
Interesting. Yeah, because because that's
That's the
it's just-
marketing. That is
right? Because
marketing.
I'm saying,
Yeah,
if
that's
someone said to
marketing
me like,
tool.
Kristina, name a I'd be, oh, yogurt.
Right, yeah.
Well, the exception is there are some companies that add probiotic strains to it. So if it says it has added probiotic strains, then that would
That should
count
be
as
okay.
probiotic. Right. I'm just talking about the regular yogurt that doesn't say that it has probiotic strains.
And now, what's a prebiotic?
Yeah.
Like, so what's the difference?
Prebiotic is something is like food for your microbes. So, the fiber that we were talking about, that's prebiotic. That's all prebiotic. So inulin is another one, there are those are things. Well, I can't say it's specifically a food. It's usually like a substance, like fiber. But yeah, eating foods that are high in fiber is like giving yourself prebiotic because the organisms are going to ferment that and it's going to make them very happy. So that's what prebiotics are. They're like the fertilizer for your for your gut community.
So basically what we've been talking about is how do you help prevent a problem with your GI tract? But then if you sense, and this is again just me thinking out loud, if you sense that you have a problem, it's important to me anyhow to get early detection to find out maybe you have like cancer or something that if detected early, you can do something about. So my point, if anybody who cares or is listening, that if you do have any kind of symptoms or problems, you really should kind of get your act together, define what these problems are like, and then go visit somebody like yourself.
So even like not even address, I just think like overall, like just like your quality of life. I know, I was making a joke, and thankfully it's not like impactful in my daily life of like existing. But I have family members who it really does, who have severe stomach problems that like it'll impact them from going out.
Exactly.
Or, going to work, or being like, I mean, there's.
I think if you're at that stage that you should look for help. I think there are some red flag signs too that should cause you to go get help.
Yeah.
So one would be you have a sudden change in your bowel habits. Like you're normally a regular person, let's say you went every other day and now you're only going once every 2 weeks. Well, that's a big change. Or let's say you go every day, but now you're having lots of diarrhea and it didn't go away after several days, right? And it's gone on for weeks.
Yeah.
If you have blood, if you see blood of any sort, you should get evaluated by your doctor. And you may go see your primary care physician first. That doesn't necessarily mean you have to jump to a specialist, but that would cause, if you've had
Would blood usually equal a colonoscopy for most people? Like, would that be a standard recommendation?
it's so interesting that you ask because I've been having this conversation.
People is the concern, like their 20s and 30s, it's increasing, and they're usually
colon cancer. You mean
they're
the
usually
incidence?
not instructed to get a colonoscopy.
It's just so interesting that so what you're referring to is that recently there has been an uptick in the numbers of young people, meaning under the age of 40, being diagnosed with colon cancer. Nobody knows why. There's a lot of research going on.
Yeah.
And so it has caused many physicians to change their recommendations.
Okay.
So that now the current recommendations that me and my colleagues are making is that if you're an adult and you have passed blood in your stool, no matter how old you are, you need one colonoscopy because we can't predict anymore, given that there's been such an increase in the numbers of young people who have had colon cancer. And, great, you have your one colonoscopy, and if everything's great, then you're good until age 45.
Right.
Unless you have a family history.
The insurance companies, I know that's also general, would they
if there's an indication, they will cover it.
They will cover it.
They will cover it. Now,
What about the other end, like you're 85 or 90?
Right. What's this? Right.
Did you get a colonoscopy?
So I'm glad you asked that question too. So currently, the United States Preventative Task Force says that at age 75, you could think about stopping screening for colon cancer. However, you should have a discussion with your physician. That's what they say. That latter part is really important to me because you have to think about the government sees that, is looking at the whole population. They don't necessarily want to make a blanket recommendation that everybody in the United States after 75 should continue to get colonoscopies. Because quite honestly, there are a lot of people over the age of 75 who have other medical issues. They could have cancer, they could have very advanced heart disease, they have very advanced lung disease. So my rule of thumb is, and when I talk to every patient about it who's over the age of 75, you're in great health. Do you and I think that you're going to survive another 10 years? Because if we do think you're going to survive another 10 years, then maybe you want to go through a colonoscopy. Now, if you have a disease where you may not survive 10 years, then it doesn't make sense to do it. You know what I mean?
Right.
So I really don't think that we should use chronologic age on an individual basis. I understand from a public health policy and cost, right? But I do think that I see very healthy individuals who are over the age of 75. And I recommend, especially if they've had polyps before too, they know that they've had a history of polyps, then I think that they should continue surveillance colonoscopy at the interval that they are recommended to. As long as they are physically able and don't have a disease, that means that they're going to
It didn't make a difference.
What about the box, the Cologuard thing?
Cologuard. So the thing about Cologuard is that this is a stool test that you can do at home. This is something that detects either hidden blood in the stool and cancer DNA. So it's a pretty good test in that people like it because you can do it in the privacy of your own home. You don't have to take a bowel prep. And the issue is that if it's positive, then you need to have a colonoscopy.
Right.
So there's no
you're
point.
going to have to go anyway and get the colonoscopy.
Right. But on the other hand, so there are reasons, like especially during COVID, we weren't doing a lot of colonoscopies at that time because people were staying at home. So Cologuard that's sort of where we saw the rise of Cologuard. The problem with Cologuard is that when it's positive, you don't know if it's the cancer DNA or if it's the blood. So if you have hemorrhoidal bleeding, it's going to hit a positive, right?
Go into full panic mode, right?
The other thing is that Medicare, as far as I know, it is not paying for it if you're past the age of, I think it's 75. They will not pay for Cologuard. Or maybe it's 80, but there is a limit to when they will stop doing it.
I had one in a while, but I did.
Yeah.
When I know I was after 75.
Okay. Well, yeah, you would have to check your insurance. And then the thing is that you would need to do it every 3 years. But there's no point in doing it. If you're not fit to have a colonoscopy, then there's probably no point in doing the Cologuard, because if it's positive, you would need to go. Now, the thing about Cologuard and why we still recommend colonoscopy is that colonoscopy can detect small polyps and we can remove them at that time. So doing colonoscopy is actually preventative because studies have shown is that if we remove polyps, we reduce your risk of getting colon cancer.
Right.
The problem with Cologuard is it may be able to detect really large polyps, but it's not going to be able to detect the small ones.
Well, we can clearly talk about this all day long. You found your right audience, doctor. But what is the best contact number for your office or?
Yeah, so let me just say, Northwell Health has over 100 GI physicians scattered throughout the boroughs and Long Island and now Connecticut. So we're a very, very large health system. So we have phone numbers for each of the individual practices, but there's also a central number for Northwell Health Gastroenterology that you can find on.
Okay, sure. And we will, I will certainly post that if you're watching our video. I'll post it on the
because I think people may want to find a practitioner who's close to where they're
absolutely
right. So
well, I can't thank you enough, Dr. Linda Lee, who is the Chief of Division of Gastroenterology at Northwell Health, North Shore University Hospital, Long Island Jewish Medical Center. Thank you so much for telling us all about
Thank you so much for having me.
My stomach feels better already, just the conversation. You're listening to Project Independence in You on LIU Public Radio.